Well, each May, we recognize Healthy Vision Month and UV Awareness Month. And the goal is to encourage people to protect both their vision and also their skin from dangerous rays from the sun. While most adults know enough to protect their eyesight, we sometimes fail to protect the eyesight of children. So joining us today is Dr. Klein, one of the nation's top therapeutic optometrists. Welcome to the show, Dr. Klein.
Thanks for having me. Thanks for spreading the word.
Absolutely. Well, it's important, but tell us why it's important to have a Healthy Vision Month.
Well, I don't think we've done a very good job of making sure that everybody understands the dangers that can happen, the dangerous diseases that can happen to eyes that are silent. And one of those is many of those diseases are actually caused by UV exposure from being in the sun and without protection. So as we get into these summer months, it's really important not only to protect our kids and our family's skin by putting on suntan lotion, but you know, the message we're trying to send is make sure that you put hats and sunglasses and get a full UV protection from those dangerous rays.
Absolutely, and because we are going into the summer months, that's a great time to start protecting. But we specifically want to talk about children, and so I'm wondering, when is the first time children should actually be, you know, having a checkup for this or looking out for UV protection?
Well, not just for UV protection, but kids should have their first eye exam well before school age. It's really important. I think most of us think of an eye exam as whether or not they see well or not, but many diseases are silent and they start from birth. We just recently had a patient that came in. It was one of my good friend's daughter. 14 years old, was her first eye exam, and she's been living with a really serious eye condition since she was born. So it's important to get that first eye exam very early, and then to protect you know, from these diseases, it's important to see what state your eye is to begin with, and get photos of the back of the eye, of the retina, and then watch change over time. So get those first eye exams, and yes, the children get so much UV exposure. We're running around outside, and I don't think anyone would think that, you know, they would let their kid run around all day without suntan lotion, yet they really forget to protect their eyes from the full dangerous UV spectrum. And it's important to ask your eye doctor to get UV Protect, which is full 400 nanometer UV 400 protection. It's important to make sure your sunglasses are good sunglasses and they're blocking that dangerous spectrum.
Yeah, I feel like kids these days are just staying inside so much more, so I'm thinking UV rays are not as important, but are you thinking that UV rays are on the rise, the damage from it?
You know, I'm not an expert on you know, environmental changes, but I can tell you from what I've seen, we're getting more skin cancer around the eye. We're getting earlier cataracts. We're seeing patients with cataracts 20 years earlier. We're seeing a lot of macular degeneration because we're also living longer. And you know, kids are spending a lot of times indoors, but that's in front of blue screens, right? Blue light exposure. So we have to be very careful about that. And you know, the atmosphere is thinning, as we all know, global warming, and that's going to allow more UV exposure. And you know, even if you spend 2 or 3 hours outside unprotected from the sun, that's still dangerous and it's additive. In fact, kids are exposed to about 80% of their lifetime radiation by the age of 18, the entire lifetime by 18. So it's really critical.
And we'd like to thank Zeiss for sponsoring this segment.